Evening, everyone, and welcome to St. John's Women culmination of the Women's History Month. My name is Dr. Jacqueline Marichaux, and I'm happy to have you ladies here with me this evening to talk about women and their stories. This year, Women's History Month has to do with, again, like I said, women telling their stories, their birth stories, and so we'll have a nice little conversation about that. So I want to introduce the panelists here. To my right is Dr. Angela Aduro. She's part of the Department of OBGYN. She's one of our attending physicians as well as the program director for the residents. Also to my right is Helen Montero. She is a community health manager, and she's part of the population health department. To my left, far left, is Miss Beverly Charles. She's a registered nurse on labor and delivery. And to my immediate left is Rosemary Vanilla. She is the VP of Physician Practice and Ambulatory Care. All right, ladies, so I'm trying to make this as organic as possible and ask a few questions in no apparent order. So I'm just going to, hand the mic over to whoever I feel like, and we'll get going. So, Helen, what were your initial feelings when you found out you were pregnant?
When I found out I was pregnant, I was super excited. I have been trying to get pregnant for like a year and a half. And it was an exciting feeling, but there was fear. Because I was in a different state without my family, without like my friends, the support that I had. Just my new family. And it was something a little bit scary for me, but very excited.
Dr. Aduro, what did you feel?
So the backstory is we had been trying and was unsuccessful, so we decided to do IVF. So if you know anything about IVF, it's not as organic to find out that you're pregnant. So after we did that fertilization, we had one egg that we ended up implanted. And so it was, you go in every couple of days to get blood work done and an ultrasound. So the first couple of days, it's like, okay, then blood work, the numbers were going up. And then the ultrasound, you started seeing things. And so when it finally hit me that it was a real pregnancy, I was beyond elated and scared and kind of nervous and just not sure if it was real because of all that we had to go through. But ultimately, it was just one of the most exciting experiences that I've had in my life.
Thank you, ladies. Rosemary, since you already have the mic in your hand, how did you prepare for birth of your child, and what kind of birth plan did you have in place?
So I did the usual things mothers do, prepare the room. We mounted the crib, bought our baby, their clothes, the newborn baby girl clothes, because I knew what it was. But it was, I was 19, I was very young, I didn't really have a plan, I didn't know what to expect, and I didn't ask for help, which I should have, but I didn't. So I just really planned the room where the baby was going to sleep. I packed my bag, I knew what to put in the bag, and that was all I really planned for. So it was just as we go.
Pass my mic to Beverly. Beverly, same question.
So I would say with my son, my firstborn, I think I went above and beyond. I had a crib, I had a car seat, I had 2 strollers. I had multiple diapers, some are newborn, some are zoo. It was just a lot. But I feel like as I moved on, it was less and less. A lot of things I carried down, passed down to the other children, and some things I just kind of just didn't do anymore. Like I had the warmer, I had everything. And then after that, it was just a little less as I went on.
So how many children do you have?
I have 4.
And how would you say your experience was from the first baby to the last baby?
So my first born, I had at 19 years old, and that was I felt a bit lonely at the time. My mom was upset with me. It wasn't planned. And I felt like when I went into the hospital and I did find out, I felt like I was judged by a lot of the nurses. I guess because I was 19, and I did look a little younger than 19. And I remember one nurse made a comment to me. I was in pain. I said something. I was in pain, and she said, "Well, this is what happens when you have sex. You have babies." And that stayed with me for a long time. And I felt like this guilt of I was in a hospital here in pain, but yet I was looked at like, "Why are you here?" So that was a bit painful. But for the most part, I did have a wonderful pregnancy. I'm very blessed and happy to have healthy children. And overall, it was a good experience throughout with all my other children. The first one was a bit more intense because the first one I wasn't ready. The second time and the fourth time I was ready. I was already in my career, and I was not as young as I was in my first.
Do you think that's what prompted you to become a labor and delivery nurse?
Absolutely, yes, I think so. And a lot of times when I have young girls that come in, I can relate. A lot of times I'm more sympathetic. I'm able to hold their hands and talk to them and even be more compassionate than if I didn't go through what I went through. So it did help me a lot to become a better nurse and a better person overall.
Good, great.
Yes.
Thank you for sharing that.
Thanks.
Helen, back to you. What was it like on the day of delivery, and how did you feel throughout the process?
Okay, so the day of delivery, that was, everything was going on at the same time. You know, all the plans that you had all of a sudden goes out the window, and you just have a new plan to go straight to the hospital. I still didn't know what I was doing, even though I went through all these classes and I had spoken to so many people. But when I get to the hospital, this was a hospital out in Georgia, I was able to have my family in there with me, my husband at the time there with me. And the plan that I had, right, my birthing plan, was to go natural. I didn't want any medication, right? I know. I didn't want anything. I had in my mind that I can do it because my sister, she had 2 girls. She was 10 years older than I am. My mother had her kids, with a doula in her country. So it was like, okay, a midwife, but I could go ahead and do this like everybody else did. Well, I stood like that maybe for like 12 to 13 hours, convincing myself that this is what I wanted. And it didn't work out that way. It didn't work out. All of a sudden, those 12 hours just kept going, and, complications started coming up. Now, all of a sudden, my son, his heart rate started dropping, and they're looking at me like, listen, we need to get this baby out. We need a C-section. Oh, my goodness. So my whole family's in there. Everybody else, it was like a show. So my dad's like, oh, no, she's getting surgery. She starts crying, and my mom starts getting nervous because this was so uncommon in my family. I was the first one to get a C-section. So everybody's panicking. They're thinking of the worst. And I'm sitting there like, somebody help me, please. One of the nurses, come talk to me. Tell me what I need to do. Thank God there was a doctor there and a nurse that actually took the time out to speak to me, explain to me the steps. And that was day 1. But there's more later.
Dr. Adura, what was your delivery like?
Oh man. Okay. So after the initial excitement of finding out that, we actually are pregnant, around 20 weeks, I found out during my anatomy scan that I had something called a vasoprevia, which is where the vessel of the baby is literally on the membrane and crossing over your cervix. So if any type of contractions and in labor, you really can exsanguinate the baby. So I take that to the bank. So I knew that I would have to deliver by C-section, and I also knew that I would have to deliver early to prevent going into labor. So I went in at 31 weeks and 5 days just for routine ultrasound and a routine NSD. And on the NSD, they found out that I was actually having contractions, which I wasn't feeling at that point. So everybody started freaking out. You know, it's like, oh, you're having contractions, you have to get to the hospital. So I go to the hospital, I get to the hospital, I'm contracting, but then they checked and said, okay, you're not dilated, so we'll just watch and see if the contractions will go away. And then overnight, there was contractions, the heart tracing was not great. So at 6 a.m., my doctor came in and says, yeah, we have to get her out. It's like, she's 31 weeks and 5 days. What do you mean? That's not happening. But once again, I had a great team that I trusted. We had a great relationship up to then. So we got the team ready and went for a C-section.
How did you think being a patient and you being the provider, how was that different experience for you?
Absolutely different, because we do this thousands of times or hundreds of times, and I've delivered many, many premature babies, and they do fine. But when you are the patient and you are being told that you are to deliver this 31-week baby who weighs 3 pounds, with all that I know, because I've seen these babies do well in the NICU go home, even with that, when you are the patient, it's really important that you take yourself out from being a physician and say, I'm a patient and I need to listen to what they tell me. Because then my mind started going all kinds of places. And my husband is not in the medical field, so I just felt like I was internalizing all that I knew that was negative about what was about to happen and sort of putting it on him, which was taking away from his experience. Because this was, even though he knew that it was premature, he was still very excited, whereas at that point there was no excitement. It was just complete fear. And then also having to have a C-section, it's then the fear of having to have surgery hits you, and all of a sudden, it's like, I've had this gap in my hand multiple times and I've never felt like this. But when you are being told that you have to have a section in like 2 hours, it's absolutely terrifying, because you kind of know what could go wrong. Not what could go right, but you know all the things that could go wrong. And at that moment, that's all that matters. It's all that could go wrong.
I can totally relate. So I'll share some things with you ladies. So my son is 9 years old, and he was not my first pregnancy. My first pregnancy was twin gestation. And I remember I was at work doing an actual delivery, and I miscarried while I was delivering someone else's baby. And so, and at that time, the labor and delivery nurse was like, oh, Dr. Marisha, when are you going to have a baby of your own? And I was like, internally devastated, but you have to be 100% there for your patient. So I delivered her, went to the on-call room, and then I cried, and then I came back and I delivered the next patient, because in my mind I felt like I had to just, you have to be 100% there for your patient. Let's fast forward. After that, I got pregnant 3 months later. And I didn't tell anyone until someone saw me, as a Black woman. Somebody was like, are you pregnant, Dr. Marisha? Because your nose is broad. And I'm like, excuse me? I'm serious right now? And so she outed me. I was about to do a C-section. And at that time, I was 20 weeks pregnant. And I worked up until 40 weeks and 4 days. And then the next day, I went in for my induction. I live in Brooklyn, so I delivered in Brooklyn in a very large hospital where they do close to 9,000 deliveries a year. And I was induced for about 29 hours, and everybody was having their baby except for me, and I ultimately ended up with a C-section. I signed out against medical advice because it was just too much. It was just too many people in and out. So I signed out, not really against medical advice. I was discharged on post-op day 2. Let me say that. And then I was readmitted a week later with preeclampsia with severe features. And so everything that could have happened, happened. And so I totally understand what Dr. Doula was talking about, because when you're a provider and you do this every day, and then all kinds of complications happen to you, it becomes a very different story. But I'll take it away from me for a little bit and continue asking questions to the rest of the panelists. Who was present, Rosemary, with you during your delivery, and how did they support you?
So my husband was present with me during my delivery. So he was 20, I was 19, so, we didn't know a lot. And my mother wasn't with me. Again, she probably was upset that I had a baby at 19 years old, so she didn't really support me. So it was just me and my husband. I felt really alone, because he couldn't help. He didn't know what to do. He was just there. And I wanted my mother, but that didn't happen. So I felt really alone. I have an older sister too. She wasn't there. It was an unplanned pregnancy. So, that's what happens in Spanish families sometimes when you deliver young. But she's the best thing that ever happened to me. My daughter is so precious to me. She's everything to me. I have 3 beautiful grandchildren. We kind of grew up together, and I would never, what happened should have happened, So that's my story.
Same question.
I do like that, Rosemary. Yes, I do believe that whatever was meant to happen, it happened, and it always happens for a reason. But I will talk about my first. I was 19, my husband was 20, and I was alone in that my mom was not there because she was a bit disappointed in me. She's had a lot of goals, a lot of things that she wanted me to do that she felt when I got pregnant would not happen. However, my husband was there. He is my best friend, and he did know a lot. He did help me a lot because I believe, a lot of times when we're going through our pregnancies and we have C-sections, we do end up a little depressed. And I do think that I had a little depression because my mom was around, and then having a C-section and feel like you were incompetent and able to do as much as I could. So I was very happy to have a husband that was there to change the baby, bathe him, and just do a lot of things that I just couldn't do because I felt so not only in pain but a little depressed because I didn't have my mom and I didn't have certain things that I thought would go a certain way. Didn't happen because I went into the hospital expecting to have a natural birth, no pain medication. It was going to be 1, 2, 3, and it didn't work out that way. So I guess I was also disappointed that the things that I had in mind for my first pregnancy did not happen, anything like that. I came in, my water was broken, his heart rate dropped, it became a stat C-section. I told him I'm not doing it. I looked at my husband, I said, honey, get my bags, we're leaving. They wouldn't let me leave the hospital. I was kind of cornered, and it got to the point where the doctor said, we have to go now. I said, no, I have to go home. I'm not getting cut. But long story short, I did give in, and I wanted to save my baby, and I had a C-section. And it's something that I don't regret. I'm very happy that I had a healthy baby. And even though it didn't go according to what I wanted, it was successful. And I had a beautiful, healthy baby boy who's 17 now. And I'm very happy.
Thank you for sharing that. I certainly can echo what you were talking about not having your mom there. When I had my son, my mom had already passed away, as well as my dad. So both of my parents had passed away by the time I had my son. But I think that I did experience postpartum depression. It's not a thought. I did experience postpartum depression. I think it really was because my parents were not around. My mom, that's all she ever wanted. She died from gallbladder cancer. But that's all she wanted was to have grandchildren. And she saw me graduate from medical school. She did not get to see me get married or have my son. But that's really all she wanted was to have grandchildren. And for me, I felt, I come from a Caribbean household and you usually have family around. And because of that, I kind of pushed people away. My best friend was around, my husband was there, And it was sort of, you read it in books all the time, but I felt like I was having an out-of-body experience. Like, I felt like something was wrong, but I wouldn't acknowledge that something was wrong. And my husband realized something was wrong. I put the baby on to change him. And then he had an accident and sort of pooped on the wall, and I left him on a changing table to go get bleached because I'm like, I can't believe that this child pooped on the wall. And so my husband was like, what are you doing? The baby's not strapped and rolled over. Are you okay? But that's what I was going through at that point in time. And I couldn't believe that, again, you read all these things in books, you take exams, you do all of these things, but you just don't believe that you're actually going through these experiences. Did any of you have any postpartum blues or feelings of sadness or depression? Helen?
Yes, definitely yes. My mom was there the day of, but when people tell you it takes a village to raise a child, it takes a village plus more. Because, my experience at the hospital while I was getting the C-section was a little traumatic for me. And I felt like nobody really knew within my family and my friends and everybody who was around me at the time what I was experiencing. So nobody could understand when I was telling them, this is, I don't want to have the baby with me right now. What do you mean you don't want to have the baby? That's your first boy. You need to have your baby next to you. I need a break. And, sometimes they expect you to be that mother that always wants to have the baby with you at all times, which I'm genuinely like the most affectionate person ever, especially with people I love. My son, I adore my son. But he was a loud baby. He was loud. The hospital pacified him. He was the only baby pacified. The nurses came by and they were trying to teach me how to breastfeed. I didn't produce that much milk. So then it's like, oh, you gotta give him formula, and then you have the moms and the Latino families. You can't give that baby formula. Breastfeed him. Drink some teas or some oatmeal to do something. Get that milk out. You gotta feed the baby. So you get all this pressure. You get all this, nice judgment, but it's still judgment. And then at the end of the day, my mom had to go home. She had to go back to New York. I was in Georgia with my then husband's family, who his mom straight up told me, I'm a new age grandma. I don't take care of kids. I was like, what do you mean? So who do I have? I don't know anything about a boy. My sister had 2 girls and everything about girls. I prepped for girls throughout my pregnancy. I had a boy. I didn't want to know what it was. I had a boy. So then I realized that I started getting depressed. Once my mother left, I was trying my best to do what I could for my son, but I just wanted an opportunity to have a break. And I couldn't find an outlet. I couldn't find somebody to help me. So then I just started shutting down. I didn't want to speak to my husband anymore. I was trying to take care of the baby, but I didn't want to get upset with the baby. It was getting too loud. I reached out to people I hardly knew for help. And thank God they came to help me. These women that helped me out there in Georgia, I will never forget. And they came through for me like never before. Yeah. So whenever we see, even now, whenever I see another either young woman or even somebody with a new little baby and they need some kind of help, what can I do to help you? I know we don't know each other that well, but trust me, I've been there. What can I do to help you? Because once you start getting down and there's no one to speak to get up, I don't know what you mean. You're looking at yourself like, what are you doing? This wasn't part of the plan. You're supposed to be affectionate. You're supposed to be the mom to take care of them. You gotta put your feelings to the back, take care of this baby, and you lose yourself as a woman. You don't know how to help yourself. So thank God for that.
So, yeah. So after I had, her name is Levi, after I had Levi, she was obviously in the NICU. And so one thing they told me as soon as I went to the NICU was, well, you need to get her breast milk. And I also knew from experience and from reading that breast milk will definitely help a NICU baby. So I became obsessed with getting breast milk. And so I will pump every 4 hours. My husband will set up the pump stuff because by the bedside, and we'll have the timer, and it'll come off, and it'll be 2 a.m., and I'm pumping, and then we'll bring it to the hospital. And I will not sleep, and so I was sort of all over the place. And my mom I had a lot of support. Thank God my family, my whole family was pretty much with us, my husband's family as well. But what happened was a week after, 4 days after I was on the NICU, I started feeling very cold. And I thought it was just excitement and the milk coming in. And so we left the hospital, we went home. Then the morning I woke up and I was just profusely vomiting. I couldn't even stand up. I was having such tremendous pain, abdominal pain. And I knew something was wrong. So I said to my husband, something's wrong. I think I have a bowel injury, right? Obviously, that's the first thing that goes into my mind because of my experience. So we go back to the NICU, we go back to the ER, or we go to the ER, and at that point, they did a CAT scan, and they thought I did have something in my abdomen, so I had to go back to the operating room. And that was extremely scary, because once again, I'm a Black woman, I just had a baby, and I'm going back into the operating room. So talk about, being on the opposite end and realizing what your patients must feel when you have these conversations with them. Because I remember telling my husband, just take care of her. If I don't make it, just take care of her. So we went to the operating room, and it was actually just a reaction. Because during the C-section, I had some bleeding. They had put some stuff in the abdomen to stop the bleeding, and I actually reacted to it. Of course I would, right? I'm an OB-GYN. So of course I would. So I reacted to it, and so that reaction looked like I was becoming septic. So they just washed it out, but I had to stay in the hospital for a couple of days. And those days I was on high dose antibiotics, and so the breast milk wasn't coming, and that was the only thing I knew I could do was pump for her. So here I am. I can't really give her breast milk. And that's all she needs. So eventually it got better. She came home, and 2 months after she came home, I just noticed constant anxiety. I couldn't sleep. It was just constant. Something was going to happen. So 3 months into it, like my husband was like, "You're not doing right." And I was like, "I'm fine. It's okay. I mean, this is normal, right? Like when you have a baby, you get stressed out." And my very close friend said, "You're depressed and you have anxiety, and you so go talk to somebody." So her husband actually is a psychiatrist, so he found me this wonderful psychiatrist. And the first thing she said was, "I need you to say it out loud. I have postpartum depression." I was like, "I do?" And she goes, "You do?" I was like, wow. So after coming through that, one of the biggest lessons, one of the things that I teach my residents is when we have these postpartum visits, because I went to see my OB-GYN, she said, "How are you? I'm fine. Are you sleeping?" "Not really, but I have a brand new baby." And that was the end of the conversation. And I tell the residents, you have to dig a little deeper. The woman that says she's fine is usually not fine, because who's fine after having a brand new baby? So I've just become hyper vigilant about making sure that women understand that we all go through it. Postpartum depression is a very common thing. There's no shame in it. But identifying and getting treatment is the best thing, because otherwise you aren't capable of providing for the kid that you so desperately want to do.
Thank you for sharing that. I've known you for 3 years, and this is the first time I've heard this. I think this is the first time we've heard each other's stories.
Yeah.
But I feel like when we're trained not to have conversation about it, right? Because I don't talk about my personal birth story or postpartum story at all. This is the first time I've actually talked about it publicly. But I really appreciate you showing the emotion. I kind of held mine back, but I appreciate you showing your emotion. Not to make light of it though, but it's something that we really need to encourage our patients to communicate about and talk to us about, and having an open forum to discuss it with your provider.
But to her point, I think it's the shame, right? Like I had postpartum too after my second baby. And it was a shame that I didn't want to bond with this baby. And why? When the first baby, I forget it. She was everything to me, and I bonded so well with her immediately. And with him, I didn't. So I think it's bringing up, you feel shameful about that, and you don't know how to bring it up. And we're talking years and years ago, guys. So I think now, it's better, right? We can recognize it more, and people have spoke out about it, and there's help out there. But when I experienced it, there wasn't a lot of resources or help. So you just went through the motions and you had that out-of-body experience that you're referring to.
Yeah, I just want to say that also I feel that now that we're sharing stories about this, we feel like it's normal. In the past, you would feel like you don't want to talk about it because you felt like something was wrong with you. You felt like, why is this happening to me? Now it's more prominent. We're now talking about it more. I feel that helps so much to make us more able to reach out to the people that we need to get help before it's too late. A lot of times too, as women, we feel like we have to take on so much. We come home from the hospital, we just had a C-section, we're still trying to clean, we're still trying to cook, we're still trying to do all the things that we did before, but just to slow down and realize that we're not machines, and we have to take that time to really heal ourselves so that we can be better for our children and our families. So thank you all for sharing these stories.
Thank you for sharing that. I wanted to just mention that postpartum depression, postpartum psychosis, whatever you're dealing with postpartum, it's a very serious issue, something that was near and dear to me, and clearly a lot of the women on this panel. And going to make a plug for our new postpartum doula care program that we got a grant for, and so it will help a lot of women in this community deal with those issues. I don't know if I would have had a doula in my personal space then, probably now, since it's not so taboo anymore. Just to help me get through certain things, help me talk through certain things. And so I'm happy that this hospital is going to embark on that.
I think it's amazing that we have this postpartum doula service, because I think a lot of times we hear these stories, especially when it's in the news, right? Especially when it has to do with psychosis. We hear this and we are aghast, like, how could she do that? And when you go through it, you realize how easy it is to do something like that, or how easy for you to become that person. So I think, if there's anything I always want my women to understand is what our parents say, our mothers say, oh, you just had a baby, we all go through it, it's fine, get over it. No, just because you struggle through it, that doesn't mean that we should all struggle through it. So, people understanding that there are services available now, and there's no shame in it. And, when somebody says, well, I went through it and I'm okay, fine, but maybe we all shouldn't have to just struggle or just weather things, right? We can actually get through it and do it in a healthy and safe environment for both ourselves, our families, and the babies.
For another plug at the Margaret O. Carpenter Women's Health Center, we do have a behavioral health specialist there as well, and he's trained to help women with postpartum depression.
Thank you, Rosemary. Another question I'm going to ask you, ladies. How did you feel when you finally held your baby for the first time, and what was your first impression of your child? Helen.
He was a cutie. I was so happy. I was so happy to have him in my arms, to look at my son. And then, after that nice, warm 5 to 10 seconds, he got loud. Then I got nervous.
Oh my God, it was just exhilarating. It was beautiful. There was lots of tears, and it was just the most amazing feeling. but she was tiny, so it was like, oh, she's so small. So now it's funny because when she talks back to me, I'm like, how do you feel in there? You know, and she said, Mommy, I'm talking. I'm like, girl, your little 3 pound used to fit in my shirt. Now you're pointing your finger at me and telling me you are speaking now. But it was the most amazing feeling. It was just great.
For me, I fell in love. And that's it. Over. Done. As soon as I saw her. So, well, she was in me as well. But when you see that face in front of you, she's like perfection. 5 toes, 5 fingers, 10 fingers, 10 toes. Not 5, sorry. 10. And she was beautiful, and I just fell in love. From that point on, I was hooked forever. So I'll always be there for her. You know how it is with your children. It's a lifetime commitment, and you're always there for them. But it was one of the happiest days of my life. So that and the birth of my son as well. I'll never forget that.
Yes, I want to say that absolutely it was all my deliveries, just that first time looking at them was amazing. It was a very happy experience for me. And one of the things is like you're bonded with this baby that's growing inside of you for 9 months. You're talking, you're listening to music. You have this connection, but when they come into the world and you hold them and you look them in their eyes, it's another instant connection. And it's amazing. It's amazing. It's worth everything.
My experience was when he immediately came out, after the C-section, and they showed me him like over the curtain, I was like, why are you so pale? I was so confused. I mean, I know the answer, right? Because black babies get their melanella a little bit later, right? But I was still like, why is it past 3 months, right? I didn't bond with him. Like I said, I think my postpartum blues really set in, but I didn't bond with him because, like I mentioned, I miss my mom. My parents were there. My mother-in-law was there, and I love her dearly. But there's nothing like your own mom. And then I brought him home, and then I was like, all right, so what do I, he kept crying, right? And I'm like, I fed you, I changed you, like, what is your problem? Like, I did everything I was supposed to do, right? And then I'm like, my husband, I called him Mr. Mom. He's amazing because he really took care of my son. All I wanted to do was go back to work. I actually took my child to work before I was supposed to go back to work, just because I wanted to get a feel of labor and delivery, because I don't think clearly I was in my right mind, right? And nobody really talks about those first 2 months, right? Because there's no real interaction. And then you start to like your baby month 3 when they're like cooing and smiling back at you and doing all of those things, and people just don't talk about those types of things. So for me, it wasn't instantaneous. I love my son. But then, let me fast forward to year 2 and 3. After he was born, he wasn't saying as many words as other kids were at that time. And I had him evaluated. And in my mind, I'm like, well, why would I have another kid if this one is not altogether there, all right? But now, if you hear him, he doesn't stop talking. He's perfectly fine. Talks back a lot. And Dr. Doula and I have constant conversations about my child and his lip service. But he's an amazing kid. I would ask this question first of Beverly. Looking back on the experience, what advice would you give to other expectant mothers who are preparing for childbirth?
Advice I would give, I would say, try not to listen to what everyone says. I feel like everyone's birth is individual. A lot of times we listen to the bad stories and the negativity of other people, and it projects on us, and then we start having these visions in our mind of it's probably going to happen with us. And I feel like we should go in every pregnancy, every delivery as if it's the first time, and just with an open mind, not knowing what's going to happen, but knowing that whatever comes, we'll handle it. And yes, you can still, you can research, you can read, you can get, reliable knowledge, reliable resources, but don't go off based on what people are saying. And also don't feel guilty, don't feel inadequate. We're all women, we try to do a lot, but at the same time, when you're pregnant, you want to slow down a little bit, enjoy the moment, take it slow, and just enjoy the time. Yeah, I would say that. Helen?
What would I say?
Yeah, what advice would you give to?
What advice? Definitely make sure that the questions that you have, write them down. Because I was forgetting everything the day of. I was forgetting everything. And, a few of my friends, later on after, a few years after I had my son, maybe when my son was already 6 or 7 years old, I came back to New York and they had doulas. And the doulas were helping them through everything, through the what choices you want, if they need to speak up and they forgot to say something, they were reminding them. I'd want to do it. If I had to do it again, back then, yeah.
I think one advice I'll definitely give people is you have to be open to that, perfectly perfect story, right? And that's the birth story is not going to be perfect. It's going to be imperfect, but the outcome is just going to be perfect, right? My daughter's 3 years old. She's just an amazing 3-year-old. You never know that she was born at 3 pounds, and so looking back, all the stuff that happened was not perfect, but the outcome was just perfect. So one thing I would definitely advise people is before you get pregnant or if you are pregnant, you want to make sure that you have a care team that you trust, right? Because things can happen, change so quickly. And if you don't have that trust, that breakdown could cause you to think something wasn't done or something was done that shouldn't have been done. But once you've established that this is the people that I trust to help me go through the most amazing, scary, just exhilarating thing I'm about to go through, and I trust them, then the imperfection is okay because ultimately you get your perfect outcome, which is a healthy mom and a healthy baby walking out of the hospital or wherever you do.
Rosemary, any of us?
Yeah, I think the advice that I would give women is just to seek help when you need help. Don't try to do everything yourself. As women, I think we need to do everything and we can't. So just seek help when it's out there. Try to find the help that you need. To your point, I wish I had a doula. That would have been amazing, but I didn't even know of doula services back then, that even existed. But if I did, I don't even think I would have sought the help. Because again, there was a lot of that shame going on with my age and everything. So just forget about that and just seek the help that you need and get the help. And to your point, the outcome is just, a beautiful baby, hopefully, 100%.
Yes, I think, what my takeaway to prospective moms out there is that at the end of the day, all we want as healthcare providers within the organization, for myself, Dr. Duro, Beverly, Helen, as well as Rosemary, is for women to have healthy outcomes, right? And for your, healthy mom, healthy baby, and for your child to matriculate. I don't look at it as, I had a C-section, or I didn't have a vaginal delivery. I want to make sure that my child can do well in school, be able to be healthy, because the alternative is actually harder. It's not, I always say that it's not having a baby, it's actually raising up the child that's really hard. And it takes, like you said, a village, right? Another thing that people don't talk about is hair. No one in this organization would know that I used to have a relaxer for a long time. I had a very, very long hair. And after delivery, well, a couple of weeks after, your hair just falls out. And nobody really talks about this, about hair. And I was very vain. And I was obsessed with my hair. And then you take a shower, you wash your hair, you see clumps and clumps down the drain. And thus is born my locks. So the length of my locks is the length of how long I've been growing them for 9 years. But those are the types of things that I think as women we should have those conversations, those stories about things that you're afraid to ask, you don't know what to ask. And bring those up to your provider, if not your provider, to your doula or whomever it is that you're comfortable talking to.
And when I was pregnant the second time, I had 2 bald spots and I lost a tooth.
Oh, wow.
But the first one was good. I have a lot of hair.
So I wanted to open up the conversation to the audience. Does the audience have any questions that they want to ask us at all?
So my question is, did you experience any challenges with breastfeeding or caring for your newborn?
Who wants to tackle that?
So I didn't have any issues with breastfeeding. Like I said before, I was obsessed with breastfeeding. A bit too much. I was one of those people. But I ended up overproducing, and that creates its own other issue. But I would say with issues with breastfeeding, I think that also goes back to what we're talking about, seeking help, right? I think most people think, oh, this should be natural. It should come easily. It's something all women do, but it's not. I was fortunate. I'm an OBGYN. I have friends who are lactation consultants. I have friends who do this all the time. So I could just shoot them a text. Hey, is this normal? Should I do this? Should I do that? But if you're not doing that, I can see how that could become stressful. I've had friends where breastfeeding is actually being one of the worst parts of their whole pregnancy delivery. So I personally did not have any issues except being obsessed with it. I guess that's an issue, but I would say definitely seek help. And nowadays there's a ton of people who are really great at information with breastfeeding. There's breastfeeding medicine, there's lactation consultants, there's OBGYNs who specialize in it, your midwives, your doulas. So just really seek help as soon as you think there's some issue with breastfeeding, and don't keep that to yourself.
So you overproduced?
Yeah.
I didn't produce any. I was very upset. I hated people like you.
Just for my grandson.
I was like praying that I would get at least 2 ounces.
It was
Like praying.
It used to like.
So you were one of those people?
Oh, I was.
Wow.
I used to I have a funny story about breastfeeding, since we talking about breastfeeding. So when I came back, I used to have the wearable breast pumps now that they have. So I was with Dr. Calvin Williams in the clinic, and it's supposed to be silent, but you hear a little. So he's presenting a patient, and he just kept looking around, and I knew what he was looking for. And I'm just like, I'm like, Brian, present the patient. Do you hear anything? No. And then afterwards, I was like, Brian, I'm pumping. For 3 years, he's never gotten over that. But yeah.
Do you ladies have any breastfeeding stories you want to share?
I believe I overproduced actually. I was dripping and my shirt was wet. And I remember my first, because I was 19, I would walk down the street and my whole shirt would be wet. So I would have to get the pads for the breast. I was just like dripping milk. But I did breastfeed exclusively for a year. It was very important for me to breastfeed. And it was a good experience. I didn't have any problems with breastfeeding at all.
Wow, you overproduced. No, because when I went back to work after 3 months, and it was a very busy service, and I just didn't have that opportunity to pump. Right, there was not a place for us to pump. Now they have a place where you can have that moment to breastfeed, but it didn't exist back then. You just had to, I think back then, like it's such a long time ago, 9 years ago, but still, we didn't have that. At least I didn't have that experience, and so, yeah, I'm jealous.
I hope it's amazing. I walked down to the OR doing surgery. Dr. Lee was one day saying, "There's something making noise in here."
So,
Yeah.
follow-up question. If for some reason you can't breastfeed, for one reason or another, whether you're not producing enough or, maybe your baby's premature and you just can't, be with them and everything like that, I feel like, yes, you're a baby-friendly hospital and, you promote breastfeeding, but, and then some mothers feel bad when they can't breastfeed. So what advice would you give to those mothers?
I would say I wouldn't feel bad about it. You can only do what you can do, right? I think that not everyone can breastfeed, not everyone can produce, and there are other options out there. And where I used to work, there used to be human donation vestibules, so where you can do that. And if that's something that you're interested in, then yes, absolutely do that. But I don't like, the shaming when it comes to not being able to breastfeed, because not everyone can, like I said. And it goes along with having a child. Oftentimes people ask me, for example, how come you only have one? Why don't you have the means, why don't you have any more? And I think that's a very sensitive question. And I think it's a very loaded question. Now that you've all heard my personal story, you probably understand why I chose not to have any more children. And I'm kind of sorry, I'm going off topic. But when I experienced postpartum depression, it was a very extreme sadness that I never wanted to experience that again. So that is my personal choice to not conceive. But again, just to remember, going back to your point, just to remember that people have, have their own choices and why they choose not to do things, and to bring certain things up. There's always a reason.
I also wanted to say that there are a lot of times that we have women that want to breastfeed. I think one of the things that they face is the lack of producing the milk. And I feel like once they have someone to help them, now that we're baby friendly, we've all been trained on labor and delivery to, help the baby latch, position it. It could be different things that we want to try before we just completely say no more. But if you really want to breastfeed, there are all resources. And we also, as nurses and lactation consultants, we sit with the patients. We are there with them. We show them how to get the baby on the breast, how to position the baby, what position works best. It's just a matter of finding what works for them to continue. Because if it's something they want to do, they want to be comfortable, and they want to find something that works for them and then continue with that.
I just wanted to add to that, saying, for somebody who was such a huge proponent for breastfeeding, and I still am, I see the value of it because of, personal experience. I'm also one of the first people that tell people it's hard work, and if you don't want to do it, don't do it. So if you don't want to breastfeed, there's no shame in it. No one should judge anyone, because a fed baby is the best baby. So if you don't want to do it, fine. If you want to do it, there's a lot of support. We will all help you. But if it's not your thing, don't put yourself through the stress of it. Because I've seen people who don't want to do it and felt forced or coerced into doing it, and that leading to more issues with their bonding with their baby. So yeah, if it's not for you, skip it.
So I wanted to thank you ladies for joining me this evening to discuss women and their birth stories. I really appreciate you sharing with the public, and especially with me. I really appreciate knowing that you two were overproducers. Still very salty about that. But I think that the topics that we brought up this evening are very important, and to sharing your experiences with everyone is the first is a start. So I wanted to thank you all for agreeing to participate. Hopefully we can do it again sometime. And thank you.
Good job.